Namaste everybody. So today we will talk about the endocrine system and some clinical conditions or diseases. So the endocrine system is one of two systems in your body that controls the other systems. So another control system is the nervous system. Okay? So these two systems control the other systems or the functions of other systems of the body. Nervous system and endocrine system. Nervous system works by electrical signal transmission. Electrical signal transmission. That's why it is very fast acting. Because electrical signal travels very fast, you know that. Endocrine system works through the hormones produced by the glands. So work through the hormones from the endocrine glands. Now, the glands of your body could be two types, exocrine and endocrine. So, the glands could be exocrine type glands and endocrine types gland. These are two types of glands. Okay? So first, we'll see the differences between the exocrine and endocrine glands. Then we'll talk about the location of major endocrine glands in the body, where the endocrine glands are located in the body. Then we'll talk about their functions. And the most important endocrine gland is hypothalamus. Hypothalamus, although it is a part of the brain, it is considered as an endocrine gland too. So, hypothalamus is the most powerful one and inside the brain. And then hypothalamus controls another gland that is called the pituitary gland. And pituitary gland is the master gland. So those two are very important glands of your body, endocrine glands, hypothalamus and the pituitary gland. Pituitary is called the master gland and boss, master. And hypothalamus is the boss of the boss. Hypothalamus is the boss of the pituitary gland. Make sense? So those two are very important and they are very closely connected to each other. Okay? So we will talk about the pituitary gland and the hormones of the pituitary gland. Then we will talk about pineal glands, thyroid glands, adrenal glands and few other glands of the body. Okay? So, two types of glands are exocrine and endocrine. How they are different from each other. If you see an exocrine gland, for example, your sweat gland that secretes sweat. You will see these are the cells inside the gland, right? And these cells secrete the chemical, and inside the exocrine gland you will see duct. Duct is a tube-like structure. So this is exocrine gland, and inside the exocrine gland you will find ducts or tube-like structures. And what happens, the hormones are secreted into the ducts from these cells. The chemicals are secreted into the duct, and the duct takes the chemical to the outside of the gland. So releases the chemical to the outside. So that is how the exocrine gland works. So from the cells of the gland, the chemicals are secreted directly into the ducts, and ducts take the chemicals to the outside, just outside of the gland. Now if you see an endocrine gland, there is no duct. These are the cells of the endocrine gland, and what happens, these cells secrete the hormone. These are the blood vessels inside the gland, okay? So what happens, the hormones are secreted into the interstitial fluid, that means in between the cells. Interstitial fluid. So first these cells will secrete the hormone in the interstitial fluid, and from there the hormones will enter into the blood. So we'll go to the blood. Then the blood will take the hormone to the outside. So the blood will take the hormone to the outside. Make sense? So let's quickly repeat it. In case of exocrine glands, you have what inside the gland? Tube-like structures called ducts. And the cells secrete the hormones or chemicals directly into the ducts. And ducts take the hormones to the outside. So it is released just outside of the gland. Make sense? Around the gland. In case of endocrine, the hormones are secreted into the interstitial fluid, that means in between the cells, right? And from there, the hormones by diffusion enters into the blood. So blood takes the hormone to the outside. Is it clear? Okay. Now you tell me, if the hormone, endocrine hormone, enters into the blood, the action of the hormone could be farther away from the gland. Makes sense? Because blood circulates throughout the body, right? Once it goes to the blood, it can go anywhere. Make sense? Because blood circulates everywhere. Make sense? But in case of exocrine, the hormone acts where? Just outside of the gland. Make sense? Just outside of the gland, because it's not going to the blood. In case of endocrine, since it goes to the blood, the action is widespread and the target could be far from the gland. Okay? So those are the differences. If I ask you, tell me few differences between exocrine and endocrine. First thing I'll say that exocrine has what? Ducts. Endocrine, ductless. Make sense? No ducts. In case of exocrine, the hormones are released just outside of the gland, so the action is localized. Localized action, just outside of the gland. In case of endocrine, The action is what? Generalized action. That means widespread. Make sense? Now you tell me which one the action could be further away from the gland. Endocrine, right? You know the pituitary gland in the brain produces the hormone that goes to the kidney and other organs, right? So far, because blood can take it anywhere. So this is action is near. Action is could be far away from the gland. Okay. So those are few differences between the endocrine and exocrine. Now, since we are talking about the endocrine system, what are the important endocrine glands in your body? As I have already mentioned, hypothalamus in the brain, pituitary gland also in the brain, and pineal gland in the brain. So those three important endocrine glands are located inside what? The brain. Hypothalamus, pituitary, and pineal. Hypothalamus controls the pituitary. So this is hypothalamus and this is the pituitary gland. So this is a hypothalamus and this is the pituitary. I said they are very closely connected. So pituitary gland has two lobes. This is the, if it is front, this is the anterior lobe and this is the posterior lobe. That means in the back. Posterior lobe. And hypothalamus can control the pituitary gland directly because it is just sitting above the pituitary. So hypothalamus controls the pituitary secretion from the pituitary gland. Pituitary gland is also called what? Anybody?
Master gland.
Master gland. Okay, so pituitary is the master gland. It's a very important gland. Okay. Now, if you go further down, here in the upper part of your thorax, you have the thymus, which is also an endocrine gland. Where it is located, I said, upper part of the what?
Thorax.
Thorax.
Right on top of the sternum.
Just behind the sternum. Yes.
Behind. Okay, it's behind it.
Yeah, like here, the upper part of the sternum. Okay. Then thyroid gland. Thyroid gland is located at the lower part of the neck, here. So thyroid, then thymus. And behind the thyroid, you have parathyroid glands. In the back of the thyroid, okay, you have parathyroid glands. Now, if this is the thyroid gland here, the back of the thyroid, you have parathyroid. How many? 4 in number. Small glands attached to the back of the thyroid, those are called parathyroid glands. Sometimes that number is more than 4, usually 4, but it can be up to 8. So that's why we say 4 to 8 in number. It could be more than 4. Attached to the back of the thyroid. Then pancreas is located here in the upper part of your abdomen. Pancreas. Adrenal glands sit on the kidneys. You know how many kidneys you have? 2. So the adrenal glands are like cap of the kidneys or crown of the kidneys, like this, sitting on the kidneys. That's why adrenal glands are also called suprarenal gland. Supra means above, renal means kidney, sitting on the kidney. So you have two adrenal or suprarenal glands. You have gonads. Gonads are testes and ovaries. Those are called gonads. So those are main endocrine glands of your body. Okay. In case of male gonads are testes. In case of female gonads are what? Ovaries. Okay. So gonads are different in male and female. Correct? Yes? No? Okay. So how many gonads do you have? 5, 6? 2. He's still counting. 2. Okay. Finally got it. Okay. So both male and female, right, have 2 gonads. In male 2 testes, 2 ovaries in female. Those are called gonads. Male gonads, female gonads. And they are also endocrine glands. You see the location in this picture. So you know hypothalamus, pituitary and pineal. Those 3 are in the brain, right? And then you see the thyroid in the lower part of the neck, front of the neck. Then in the upper part of the thorax, you have the thymus. On the top of the kidneys, you have adrenal glands or suprarenal glands. And then you have the pancreas, in the upper part of the abdomen, placed horizontally like this. Then you have the gonads. Okay? Okay, now here you see, I told you that hypothalamus is just above the pituitary. So this is the pituitary gland, okay? And this is the hypothalamus. So hypothalamus and pituitary, right? And hypothalamus controls the pituitary gland. And I already told you that pituitary gland has 2 lobes, anterior lobe and posterior lobe. Okay, so anterior pituitary, posterior pituitary. Make sense? Okay. Now, the anterior pituitary releases 7 hormones. And posterior pituitary or posterior lobe releases 2 hormones. Okay. So anterior pituitary or lobe releases 7 hormones, and posterior releases 2 hormones. What are the anterior pituitary hormones? Anterior pituitary hormones are growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, prolactin, follicle stimulating hormone, and so 1, 2, 3, 4, 5, and a couple of those are not listed, like follicle stimulating is there. Let's go back. So growth hormone is one. FSH, follicle stimulating hormone, is another. Luteinizing hormone, LH. Then adrenocorticotropic hormone, prolactin, and thyroid stimulating hormone. Let me write it down.
3 seconds.
I'll write it down here.
Okay.
That will be easy for you. It's not listed here properly. Yeah, so the pituitary, this is the pituitary, this is the anterior, This is the posterior. Okay, so anterior pituitary releases thyroid stimulating hormone. Thyroid stimulating hormone. Okay. Adrenocorticotropic hormone. Now you tell me, if I say anterior pituitary releases thyroid stimulating hormone, its name is telling you this hormone will stimulate what? The thyroid. That's why it is called what? Thyroid stimulating hormone. Make sense? So it will go to the thyroid gland, from here to the thyroid gland, right? And will stimulate the thyroid gland to release thyroid hormone. Now tell me, adrenocorticotropic, that means it will go to the adrenal gland. Make sense? Sitting on the kidneys. Remember I said 2 adrenal glands. So this hormone goes to the adrenal gland and it stimulates the adrenal gland to release adrenal hormone. Then growth hormone, GH. Very simple. Have you heard growth hormone? I think most of you. Growth hormone helps to grow the body. That's why it is called growth hormone. Okay? So it is also an anterior pituitary hormone. Follicle stimulating hormone. Follicle stimulating hormone, or FSH. Follicle stimulating hormone. This hormone works on the gonads, testes and ovaries. You can write it down. Follicle stimulating hormone works on the gonads. In case of male, testes. In case of female, what? Ovaries. Make sense? Luteinizing hormone, LH. Luteinizing hormone, or LH, helps in ovulation. Ovulation. The release of egg from the ovary. That is called ovulation. Then we have thyroid stimulating hormone, adrenocorticotropic hormone, growth hormone, follicle stimulating hormone, luteinizing hormone. Another is called prolactin. Prolactin works on mammary gland or female breast and produces milk. Help to produce milk. So those are actually 6, not 7. Those are 6 anterior pituitary hormones. 6 hormones, okay, in anterior. And 2 posterior pituitary hormones are oxytocin and antidiuretic hormone, ADH. So those are 2 posterior pituitary hormones. Now I will quickly go over the functions. Anterior pituitary, thyroid stimulating hormone works on which gland? Thyroid. And it stimulates the release of thyroid hormone. Make sense? From the gland. Adreno will work on adrenal glands, sitting on the kidneys, but adrenal glands, right? And will tell the adrenal glands to release adrenal hormones. Make sense? That's why it is called adreno. Why it is called adrenocortico? Because adrenal gland, if you cut the adrenal gland, this is your kidney, sitting on the kidney, adrenal gland. If you cut it, it has 2 parts. Outer part is called the cortex and inner part is called medulla. Now, this hormone, ACTH, works on the cortex part. That's why it is called adrenocortico, working on the cortex, not in the medulla. Make sense? Okay. Then growth hormone. Now growth hormone, remember, works on all the tissues of the body. Works on all types of tissues of the body. But, there is a but the action of growth hormone is more prominent on two structures, skeletal muscles and bones. So you can write it down. So growth hormone works where? I said everywhere. First answer is what? Everywhere, in all tissues, right? On all tissues. But the action is more where? In the skeletal muscle, right? These are the skeletal muscles and the bones. And that's why you see the action of growth hormone is so clear, prominent, right? When growth hormone is injected, the body, skeletal muscles grow fast, right? The bones grow fast. That's why the person grows fast, right? And you know, growth hormone is used in farms to grow the cow or a chicken quickly, or fish. Its action is very clear and quick, prominent, right? Follicle stimulating hormone, what did I say? What's on? Gonads, right? Testis and ovaries. Make sense? Testis and ovaries. Gonads. Luteinizing hormone does what?
The ovulation.
Ovulation. Release of egg. Okay? Prolactin helps in the production of milk in female breast. Okay? So those are. Now let's go to posterior pituitary hormones. Oxytocin and antidiuretic hormone, or ADH. Oxytocin is very powerful hormone. It helps in uterine contraction during childbirth. You know, during childbirth, what happens? The contraction of uterus, right? Strong contraction of uterus occurs. So, uterine contraction. Number one. Number two, ejection of milk. Ejection of milk from female breast, okay, or mammary gland. Now you tell me, if I ask you the question, which hormone helps in the production of milk? Prolactin, right? And it is anterior or posterior pituitary hormone? Anterior. If I ask you which hormone helps in the ejection of milk? Oxytocin, which is anterior or posterior? Posterior pituitary hormone. Okay, so just don't forget that. Okay, now those are two very important functions of oxytocin. One is the uterine contraction that helps in childbirth, and another is ejection of milk, help to feed the baby. ADH, what's of kidneys? Antidiuretic hormone. Another name is vasopressin, because this hormone also works on blood vessels and causes vasoconstriction, presses the blood vessels. Presses the blood vessels. Make sense? Vasopressin. Now you tell me, antidiuretic hormone. If I say antidiuretic, anybody knows diuresis? Diuretic? Have you heard? Anybody? Diuretic? Diuretic? No? Right. Diuretics produce urine. More urine, right? Very good. Anybody else, or only he didn't hear? Diuretic? Commonly, we see in the newspaper, magazines. So diuretics do what? Produce more urine. Now if I say antidiuretic, that means what? Less urine. Anti, right? Opposite. So antidiuretic hormone produces less urine. Is it clear? So decreases the production of Urine. Who produces urine? Kidneys. So that's why I said it works on the kidneys, right? And decreases the production of urine. Make sense? Okay. So if I give a medicine that will block the antidiuretic hormone, then what will happen? More production will be more, right? So that is a medicine. If someone gets hypertension, high blood pressure, sometimes you'll see the doctors give the medicine that will produce more urine. That will reduce the blood volume, right? When blood volume goes down, blood pressure goes down. So that's the mechanism. Antidiuretic is blocked by that medicine, like vaccines. Okay, so those are the pituitary hormones and their actions. Now, you see this guy? It's very big, right? This is a very famous picture, and this person is from East St. Louis, Alton place. Yeah, he used to live there. This picture has been used in many countries' textbook. You'll find this picture. Okay? He is a very famous in that way. Anyway, so this condition is called giantism or gigantism. Have you heard that? Giantism? Okay, so the person grows very big, much bigger than average people, right? So, what causes that? Which hormone? What do you think? Growth hormone, right? Excess or overproduction of growth hormone can do this, right? Now, for the normal growth of the body, you need what? Normal amount of growth hormone, right? Everybody, we all need normal amount of growth hormone for normal growth of the body. Now, if someone's pituitary produces too much growth hormone, excessive amount of growth hormone, then what will happen? The body will grow big, fast, right? So that is called giantism or gigantism. Increased growth hormone production will cause giantism or gigantism, same thing. Now, if during the growth of the body, when the body grows, early part of your life, right? Growth hormone secretion is more, body will grow fast, right? Make sense? Because bones are still growing. Now, after your growth is completed, after the growth of the body is completed, if after the growth is completed, the growth hormone secretion occurs more, then what will happen? Body will not be able to grow anymore because the bones already, ossification, the bone formation has been completed. Okay? So bone has no way to grow further in length. But what will happen? The bones will grow in width. So that is called acromegaly, not giantism. In that case, body will not grow further. But what will happen? The bones will grow in width, sideways. And that is called acromegaly.
Did you say that happens when the growth plates are closed?
Yes, exactly. So, giantism will occur if the growth hormone secretion increase during the growth of the body. That means before puberty. And acromegaly will occur if the growth hormone secretion was normal during the growth of the body, right? But suddenly pituitary is now producing more hormone after the growth is complete. Make sense? So that is acromegaly. if growth hormone secretion is less than normal, the person's body will not grow like a normal person, and that will cause dwarfism. Dwarfism. So less production of growth hormone during the growth of the body will cause dwarfism. More production of growth hormone during the growth of the body will cause gigantism. Okay? So now you know that normal amount of growth hormone secretion is very important, right? Now, the gigantism person or giant person, the lifespan is much shorter than average normal people. Because I told you the growth hormone works on all tissues of the body, right? So the heart of that person will be what? Bigger. Liver size is bigger, right? So the bigger size is not good. Normal size is good. Small is not good. Big is not good, right? So if your heart is, another problem is that almost all cases the giantism patient suffers from diabetes mellitus, diabetes. Okay? So because the growth hormone also increases the blood sugar. Growth hormone does what? So in these people, blood sugar is always high. Okay? So that will burn the pancreas eventually, high sugar always, right? So over function of pancreas, right?
So like they don't, like the organs don't grow to compensate for the size, they just give out because they're too big.
If like any organ is bigger, that's hypertrophy of organ, like the enlarged size. If your heart is big, then the blood pressure will be high. Okay, and that heart function eventually will go towards heart failure. If something works too much, that will move towards failure of that organ. Okay, pancreas is working too much because always blood sugar is high, right? So pancreas is secreting insulin all the time, insulin. So overfunction of pancreas will burn it. So the person, and once you get diabetes for many years, the other organs are affected too, right? Diabetes affects other organs. So overall, the lifespan of giantism patient is, or people, is short. Okay. Now, what can cause over secretion or hypersecretion of growth hormone? One cause is tumor, pituitary gland tumor. That is the adenoma of the pituitary gland. Okay? So if you surgically remove that tumor or destroy it by radiation, then that's the treatment of that hyperpituitarism. Hypopituitarism, if the pituitary gland secretes less than normal, that is called hypo. Hypo means less. Pituitarism is the condition where pituitary gland is secreting less than normal amount of hormone. Okay, so in that case, to stimulate the pituitary, we use some hormones, thyroxine, cortisone. Cortisone is steroid. Steroid works on many organs. So steroid also will stimulate the pituitary. So pituitary will release more hormones. So basically, these chemicals are used to stimulate the pituitary gland because pituitary is secreting less hormone. Thyroxine is a thyroid hormone. Cortisone is a steroid hormone, growth hormone, and sex hormones. They can stimulate the pituitary. Okay, I have already talked about oxytocin and antidiuretic hormone or ADH. Okay. Now, there is a clinical condition that is called diabetes insipidus. I talked about that in last class when I talked about the urinary system. This is the nephron. You remember the loop of Henle, distal convoluted tubule and collecting duct. And I said ADH works here. Antidiuretic hormone works on the collecting tubule. Collecting tubule. And antidiuretic hormone takes the water back into the body. So the volume of urine will be less because from the kidney or nephron, water is taken back into the body. So the output of urine will be less. Make sense? That's the function of antidiuretic hormone. Less urine production, right? Now, if the pituitary gland is destroyed, posterior pituitary is destroyed by tumor, then antidiuretic hormone will be not produced or less produced. In that case, no water reabsorption will occur. Water will not go back to the body. Make sense? So if water cannot go back to the body, water will stay in the kidney, right? And will get out as urine. So more urine will be produced because you are blocking the antidiuretic hormone, right? So more urine will be produced. The person will frequently go to the bathroom, right? Pee a lot. Is it clear? So that is called diabetes insipidus. Insipidus. Okay. It's not related to insulin or sugar. It has nothing to do with insulin or sugar. It is related to which hormone? Antidiuretic hormone, right? Less production of antidiuretic hormone will cause more production of urine. Okay, so that is another clinical condition related to the pituitary. Okay. Okay. Thyroid gland. Now let's go to another gland, thyroid. Thyroid gland is located, I mentioned, the front of the lower part of the neck here. And if you see the thyroid gland, first we'll see the anatomy of the thyroid gland. It has two lateral lobes. These are called lateral lobes. So two lateral lobes, and they are connected by a structure that is called isthmus. Okay. So that is the thyroid gland. Two lateral lobes connected by an isthmus. Now, thyroid gland produces thyroxine and thyroxine is also called T4, tetraiodothyronine, and another is called triiodothyronine, which is also called T3. So thyroxine or tetraiodothyronine, T4, and triiodothyronine or T3. So T4 and T3, those are two important hormones, and another hormone that is also released by the thyroid, that is called calcitonin. Calcitonin. So those are three hormones. Okay, 1, 2, 3. Now, T3 and T4. Why we say T3 and T4? T3, I said, also called triiodo, tri. tri means 3, right? You know that. Its name is telling it, you see, triiodothyronine. So how many iodine is there? 3. Make sense? Name is telling you triiodo. How many iodine? 3 in that hormone. So to make that hormone molecule, you need 3 iodine atoms. 3 iodine atoms. Is it clear? Tetraiodo or T4. How many iodine atoms you need? 4. Make sense? So to form a T4 molecule hormone, you need 4 iodine atoms. To form or produce T3, you need how many iodine? 3 iodine. That's simple. So now you know also, you know that to produce thyroid hormone, you need what? Iodine. Is it clear? That's why, you know, we say that iodine is very important. Iodine, you know, you eat iodinized salt, right? Why? Because thyroid is a very important hormone, right? So lack of iodine will do what? Will produce less iodine hormone. Make sense? Because to produce the hormone, you need iodine. Okay, so iodine is essential.